Hello everyone, this is Dr. Sarosh Siddhaki from the platform of UKMLA with DSS, and let's just move on to our next lecture for the course, that is suicide risk assessment. Okay, so you may see this station in the exam in which a patient must have attempted to harm themselves by either taking an overdose of a medication. It's either going to be an OCP or paracetamol, and they may have done an act that would be leading to self harm. Like, for example, in this case, this patient has cut her wrist. Okay, so your task would be to basically assess the future risk of suicide. Okay, counsel the patient and try to be supportive to the patient, discuss the management of the condition. Okay, and then address whatever the concerns the patient have. Okay, so the counseling aspect is there, the advice aspect is there, the medical management and addressing the concern aspect is there, but the most important thing that you need to do in this station is basically assessing the future risk of suicide, and that is what your task is as a psychiatry doctor. Okay, or as someone who is aware of the psychiatric issues. Okay, so let's just discuss the layers, and let's just discuss the structure that we need to follow in this particular type of station. Okay, now the very first thing that you need to do, okay, is number one, you need to explore that what overdose was. Okay, the exploring the overdose, that which medication was it taken, how was it taken. Okay, and there are a couple of questions that you need to ask about it. Number one, which tablet did you take? Okay, it was paracetamol, it was opioids, it was OCPs, it was antibiotics. Okay, it was antiemetics, it was antihistamines. Like, what was the tablet that they took? Okay, the first question. Then how many tablets did they take? Okay, I took 40 tablets of paracetamol, I took 6 tablets of OCPs. Okay, then you ask that was it taken with water or was it taken with alcohol? Yes, it was under the influence of alcohol, and I just took it while I was drinking. No, I just took it with water. Okay, then you need to ask about that. Okay, so since how many hours it has been that you have taken these medications, or when did you take these medications? Okay, because it has a lot to do with the bioavailability, and you have to see, and your medical management basically depends on the time, when you have taken this medication. If it's taken acutely, it must be there on the stomach. You can manage it by gastric lavage. But if it's not there, if certain amount of time have passed, then you may have to do some medical management. Okay, like, for example, giving N-acetylcysteine in the case of paracetamol poisoning. Okay, so the time duration is like also very important. Okay, then where did you get it from? Okay, was it an over the counter medication? Did someone supply it to you? Was it there prescribed to someone else? Like, for example, maybe your mother is taking the OCP, your mother was taking paracetamol for a fever, and you just took it. Okay, and then why did you take? Okay, this question is like really important, that why did you take it? Okay, and after you're done asking these 5 questions, this question becomes a bit tricky, because the patient, would be, again, since it's a psychiatry station, the patient would be in the defensive mode. Okay, in their defensive posture. Okay, and they may not be answering your questions as readily as a normal patient of uh, normal patient having any other medical condition, may answer your questions. Okay, so why did they take it? Okay, it would be difficult for you to make them open up and make sure that they're answering this question. So this is where your sympathy or validation would come into play, that okay, I understand that whatever the situation was, and I understand that since you took such a big step, there must be something seriously wrong, and I would like to tell you that whatever you're going through, we're going to help you with it. Okay, and this is a safe space, and whatever you discuss would remain confidential between you and the medical team. um, so I know you have gone through a lot, and I know things must be very overwhelming for you right now. But will it be okay if we can just have a chat, and if you can tell me uh, what happened that led to you taking such a big step in your life, that you just wanted to end your life? So Will it be okay if you can just share some information and just try to answer my question so that I can help you in a better way? Okay. So make sure that that aspect of identifying the non-verbal clues, identifying the issues, identifying the discomfort of the patient, okay, that is there, and you know how to make sure that the patient is comfortable, the patient is calm, and patient is willing to you know ask these questions and also basically answer these questions. Okay. So yeah, these 5 to 6 questions is basically how you would explore the overdose. That okay, what medication was it? How many medication did they take? Since how much time have passed since they've taken the medication? Where did they get it? Was it with alcohol and was it with water? Okay, so that is the very first thing that you need to keep in mind and that you need to discuss. All right. Now the main task, okay, like as you can see, it states that you need to assess the future risk of suicide. Okay, so this is the main task that you need to be aware of. All right, and how you're going to do that? There is 7 to 8 different questions, okay, regarding this that you need to have in your mind in order to assess the future risk. Okay, and I'll tell you what the answer of each question would mean. Okay, let's suppose you ask the first question that did you call someone before doing this? Okay, if they called someone, okay, that means that they wanted to get saved. Okay, they wanted somebody to know that okay, they are taking this step. Okay, so it was more of an attention seeking or more of a just attempting it for the sake of attempting it, kind of a suicide. Okay, so did you call someone before doing this? If they called anyone, okay, but if they say that okay, they did not call anyone, that means that they were very clear on the fact that they want to take their life. Okay, number one. Number two, did you lock the door while you were cutting your wrist and while you were taking the medications? Okay. Again, if somebody locked the door, that means they're serious. Okay. That means the risk of suicide is very high. But let's suppose somebody kept the door open and then was showing everyone that okay, this is the medication that I'm taking. Here I am cutting my hands. Okay. So that means that they are at a low risk of suicide and it was just a attempt for the sake of attempting it. Okay, then did you write a suicide note? Okay, if somebody is writing a note, that means it's serious. Okay, they want to like actually kill themselves and they actually want to end their life. Okay, so the presence of suicide note is like really important. Okay, which knife did you use? Was it a sharp knife? Was it a butter knife? Okay, somebody if is trying to kill themselves using a butter knife, that means that they're not actually trying to harm themselves, they're just actually trying to show that they're going to harm themselves. Okay, so if but somebody just used something like that, then they are at a low risk of suicide. All right. Then do you have friends and family available? Okay, support system is like really important, uh, because if you don't have the support and if you don't have friends, if you do not have a family, then loneliness is a very high risk, puts you at a very high risk of suicide. Okay, one of the major risk factors, not having friends, not having family members, uh, puts you at a higher risk of suicide. Okay, then do you regret doing it? If they don't regret doing it, okay, they're saying no, I don't regret doing it. Okay, then that means that they're at a higher risk of suicide. Okay, and the next question, will you do it again? Are they willing to repeat it again? Okay, and if they say that yes, I'm going to repeat it again, that means that they are again at a very high risk of suicide. Okay, so there are like 7 different questions, 1 2 3 4 5 6 7 different questions. Okay, and if you are getting positive answer on 4 out of the 7, okay, that means the patient is at a high risk of suicide or patient is at a low risk of suicide. Okay, if you're getting 4 answers that shows low risk, then that means that the patient is at low risk. If you find that okay, majority of the questions are pointing towards the high risk of suicide, okay, then you know that okay, this is the patient who is going to do it again. Okay, so you need to have these 7 questions in mind. Did you call someone, locking the door, writing a suicide note, attempt? So basically the butter knife, okay, it's not always going to be there. You need to ask whether or not they took a violent step or not. Okay, let's suppose if the patient tried to harm themselves not by cutting their wrist but trying to strangulate themselves. Okay, then you going to ask that, okay, what did you use? Did you use an actual rope, or did you just use a piece of cloth to maybe hang yourself like this? Okay, so you need to understand and you need to figure out the intensity by which they wanted to kill themselves. Okay, if somebody tried to jump and tried to kill themselves by jumping, so like what did you do? Like, did you just stand on a table and just try to jump on the floor, or did you like actually go to the rooftop and then try to make an attempt from the third floor, instead of just trying to just hop a window? Okay, so you need to understand the kind of severity and the intensity that the patient showed while attempting to kill themselves. Okay, and then friends, family, and do you regret doing it, and will you do it again? Okay, these 5 to 7 different questions you need to ask in order to explore whether or not the patient is at a risk of suicide or not. Okay, so these two layers very important layer. Okay, then let's again move on to the psychiatric aspect. Remember, in the previous two psychiatric lectures, as well, in fact the previous three psychiatric lectures, I discussed the fact that there are three important parameters of the psychiatric history. That is, number one, the mood, hallucination, and the risk of self harm. In the schizophrenia station, the hallucination was the problem. In the depression station, the mood was the problem. And now this is the suicide risk assessment. Over here, the self harm was the problem. Okay. So, like the fact that we discussed the hallucination part in detail in schizophrenia, the mood part in detail in depression. Okay, we have discussed the suicide part in detail in this suicide risk assessment case. Okay, but the other two aspect needs to be explored nevertheless. Okay, so you're going to just ask that, okay, how is your mood on a scale of 1 to 10, with 1 being the lowest and 10 being the best mood that you have had. And then you're going to explore the hallucination, that you see or hear anything that may not be usual or that may not be seen by others. Okay, so these three layers are like very very important. The psychiatric aspect is already clear. We have talked about it in detail in the previous lectures as well. Okay, so I'll move on to the next layer. Okay, now DESA and MEFTOSA both. Okay, like because there are a few factors, okay, that you may pick up from the DESA, and then there are few factors that you may pick up from the MEFTOSA. Okay, so you need to make sure that your fourth layer is combined between DESA and Leftosa. Okay, in the DESA, diet is not that relevant. Okay, so the drugs. Okay, like somebody who is doing drug abuse. Okay, they are automatically at a high risk of suicide. Okay, the drug abusers do end up taking their lives. All right, you need to keep that in mind. Number one, chronic alcoholics, again a risk factor for suicide. Okay, you need to make sure that you need to ask that whether or not the patient is a chronic alcoholic, or whether or not they take alcohol on regular basis, because that is something that is going to put them at a higher risk of suicide. Okay, and then past medical history, people with chronic illnesses, people with untreatable diseases. Okay, they often get fed up with their life and they want to take their life, and they want to kill themselves. Okay, so we got to ask about that. Number one, number three, sorry. Then the family history. Okay, if there is a suicidal tendencies that runs in the family, and they're seeing people killing their life in the family, then automatically it puts a particular patient on a higher risk of repeating something like this, and doing something like this in the future. Okay, then travel may not be important. Okay, occupation may be important, financial stresses in life, somebody struggling financially, somebody struggling in their work life. Okay, they may just want to take away their life. Okay, then the social history. Okay, these questions will be very much similar to the one that we asked in depression. Okay, who is at home? Do you have friends and family members? Okay, if nobody is at home, if there is no friends, he has lost his friend because of any issue, because of his drug habits, because of his alcoholism, or if they have lost their family members because of a divorce, or because of their anger issues. Okay, or whatever it is, and if they're living alone, okay, automatically they would be at a high risk of suicide. All right, so the DESA and the Maftosa part, or the fourth layer, is basically you trying to explore the risk factors. Okay, so there's a difference. Assessing the future risk, okay, it's something different, okay, and assessing the risk factors in the DESA and the MEFTOSA part, it is like quite similar but not same, okay. So you need to keep that in mind. All right. Then the sexual history may be important only in the case when the overdose is of OCPs. Okay, if somebody is taking OCPs, okay, and the patient who would be taking OCPs in the exam, she would be the one who has had a problem with her boyfriend. Okay, so you may want to ask about the sexual history in this case. That okay, are you sexually active? Do you have a stable partner? By any chance, do you practice safe sex? Okay, and just ask about the pills that apart from the OCPs, do you take any other pills regularly? Okay, so just briefly touch upon the sexual history. That ask about the partner, ask about whether or not they're sexually active, and just ask about the protection. That okay, have you had any unprotected sexual intercourse by any chance? Did you get pregnant and that is why you had a fight with your boyfriend? Okay, so the sexual history, you may have to touch upon it very briefly, not in a lot of detail like the one you go in the gynae and the obstetricians. Okay, you don't need to go into that much detail, but just to slightly touch upon it to get a better idea of the situation. Okay, just a couple of questions. All right, do not go into a very detailed sexual history. All right, and then anything else if it may be relevant or not. Okay, so this is how you're going to go about it. This is how you're going to assess and how you're going to find out that whether or not a patient is at a higher risk of suicide or not. Okay, the dose, exploring the overdose, exploring the drug, future risk, psychiatric aspect, and the risk factors, okay, that may have led to that particular situation. All right, based on your assessment and based on your understanding, if you see that the patient is having the future risks, okay, and the attempt was such that the patient may repeat it again, okay, and if you are also getting a few risk factors from this section, that okay, the patient is chronic alcoholic, the patient is taking drugs, and the patient has financial stresses in life, the patient is living alone, okay, all of these things would put the patient at a higher risk of developing suicide. Okay, but let's say if the patient had a low future risk, okay, and he did call someone, he didn't lock the door, he did not write a suicide note or something, he just used a butter knife, okay, and he also regrets it, then they're not taking any drug, they're not taking any alcohol, okay, there is no financial stresses in life, just a bit social problem that like they might may have a fight with their boyfriend, okay, or they may have a fight with their partner, okay, or a kid may have a fight with their parents, okay, and they just did something impulsive without even thinking. Okay, so if you're getting those ideas, then it would automatically put the patient on a lower risk of suicide, on a lower risk of doing something like this. All right, so you need to focus on these two layers, okay, the future risk layer and the risk factor layer, or the desamorphosa layer. All right, and then based on your assessment, what explanation would you give? That thank you so much for answering all my questions, Mr. Adam or Miss Jessica, whatever the name of the patient is. And then you have to be very supportive, that I understand that things did not go the way it should have been, and I know that things were very overwhelming for you, but don't worry, we are here for your support. And I would like to tell you that from the chat that we have had, and from my assessment, I feel that it is likely if the patient is at a higher risk of suicide, okay, or it is unlikely if the patient is at a lower risk of suicide, that it is likely or unlikely that you will be repeating this act of self harm again. If it is unlikely, then you're going to say that okay, it is something that you must have done, without thinking and by being impulsive. But it feels like that you regret it, and you're not going to repeat it in the future. Okay, so but if it's, let's suppose if it's likely, and the patient is at a higher risk of suicide, then you got to say that it's very likely that you're going to repeat this thing And for that purpose, what I would like to do is that I would like to immediately admit you under the psychiatric team. Okay, so you need to offer admission. Okay, if the patient does not regret his act, or there is a high risk involved. Okay, so you need to definitely admit the patient, okay, in this particular case. All right. Then the other case, if the patient doesn't think good about his future, he says that, okay, doctor, my life is ruined, and I don't know where I'm going with my life, and I think I'm not going to do it again. So always admit the patient. Okay. Then if the patient is having more suicidal thoughts, that, yeah, doctor, I still have the thought of harming myself, then you have to admit the patient. Okay. And if the patient has a mood of less than equal to 4, okay, it is very very important that you admit the patient. All right, because if you do not offer the admission to this patient, and let's suppose this patient gets discharged after your consultation, okay, and then you go home, and then you are chilling, and then you're just sleeping peacefully, that, oh, I have seen 18 patients today, I've seen 20 patients today, and then you get a news that one of the patients committed suicide, and the last consultation that that particular patient had was with you, was with Dr. Sarosh, and then the GMC has opened an inquiry on the name, that why didn't they, identify the risk of this patient developing suicide, and why didn't Dr. Sarosh, or why didn't Dr. XYZ, whoever saw the patient last, offered him admission, offered him help. Okay, so always make sure that you offer admission. Okay, and the referral needs to be there to the psychiatry, immediate referral needs to be there to the psychiatry unit. Apart from that, the investigations would be just the baseline investigations. Okay, there wouldn't be any medical management involved for the psychiatric aspect, but yes, there would be some medical management involved for the drug overdose. Okay, like let's suppose somebody is taking paracetamol, so we are going to say that, okay, we are going to keep you under observation, we are going to run some investigations, check your paracetamol levels, and if it is above the normal level, then we may give you a medication called acetylcysteine, or if it is not there, then we're just going to give you some IV fluids, and keep you under observation for a good 8 to 12 hours, just to make sure that the drug has been cleared from your blood and it's not causing any harm. And if somebody is taking OCPs, then you may have to for the medical management of it, you may have to do a gastric lavage, you need to do a stomach washout. Okay, so all of those things, the medical management aspect would be for the overdose aspect, for the overdose of the uh, drugs basically. Okay, and then advices would be very very important. Okay, specifically if the patient is at a low risk of suicide and you are sending the patient home, then you need to give aggressive advices on lifestyle modification, like for example, trying to think positively about the life, do not take any alcohol, do not smoke. Okay, if they are involved in any drug abuse, then we need to advise about them, about that particular aspect, try to say them that, okay, try to join some rehab groups, try to join some social groups, try to go on a walk, try to go to the gym. Okay, and advices on taking psychosocial therapy, the referral to the psychosocial therapist. Okay, the counselors, it needs to be there. And if somebody is if it's a couple problem, if one of the wife or the husband, if they try to commit suicide because of a couple related issue, then send them for the couple counseling, and try to link them to support groups. Okay, where a lot of people who have been struggling with mental health illness, all of them, they can come together, and together they can help each other, get involved in positive activities that will help to change their mindset and help to change the way that they think. Okay, so all of these advices would become very very relevant in cases like these. And then of course the safety netting needs to be there, very 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 strongly you need to safety net, just like the way you safety net in a depression case, that if you ever feel the need to harm yourself, if you ever see or experience something unusual, if you feel that your mood is declining and it is becoming less than or equal to 4, then please visit the nearest A&E. Please go and visit the nearest GP surgery, or call us, so we can help you go through this and help you get through this. And also mention the crisis home resolution team. It is very, very important for people like these who are at a higher risk of developing suicide. So all of these options, you've got multiple options like CBT. I talked about CBT, support groups, rehab groups, advices about exercise, advices about quitting smoking, positive thinking, crisis home resolution team, nearest A&E, nearest GP. Just call the A&E and call. Just talk to a doctor. Okay. So you've got numerous advices to make. Okay. So if you've got that much content, then try to use it in your consultation. Okay, at the right place and at the right time, because in the psychiatry stations, okay, the medical management, yes, it is important, but it may not be the most important thing. Okay, you need to have the approach, you need to have this thing in your mind that okay, you need to give more importance and you need to give more attention and more importance to the advices part and the safety netting part, specifically when you're discharging a suicide risk patient or a psychiatric patient to their home. Okay, they may end up doing anything. Okay, so you need to make sure that you're on the top of your game. You need to make sure that you are able to identify the risks, and that is why I am constantly in every session, in every lecture, I am teaching this thing. Then when to admit, and if the patient is not agreeing to get admitted, then what are the tips and tricks that you should use to admit the patient. Like for example, in the schizophrenia patient, use the smart way, use the situation to convince him, or use the mental health act. Okay, but you need to identify that when to admit, because if you send the psychiatric patient home and if they were at a high risk of harming themselves, and if there was an indication for admission and you did not offer admission, okay, then you may be in hot waters. Okay, and you don't want that. All right, so with that, we are done with the suicide risk assessment. If you've got any queries, any questions regarding it, or any psychiatric aspect, then please drop them down in the comment box below, or reach out to our social media to drop down the queries. I would love to address any concern that anyone have. All right. So with this, it's the end of today's lecture. See you in the next lecture.